definitions. Now, diffusion is the movement of osmosis, diffusion, and filtration for the fluids in your body. Now let's go through some fancy medical definitions. Now, diffusion is the movement of solutes from an area of greater concentration to an area of lesser concentration, leading ultimately to equalization of the solute concentrations. It occurs through random movement of ions and molecules. Now, a great example of diffusion would be the exchange of oxygen and carbon dioxide, also called CO2, inside the lungs between the pulmonary capillaries and the alveoli. Now, osmosis is kind of like the wet version of diffusion. So osmosis is the movement of fluid from an area of lower solute concentration to an area of higher solute concentration with eventual equalization of solute concentrations. Basically, the whole goal of diffusion and osmosis is to balance and equal out the playing fields here. So we don't want any clumping or crowding. It's all about sharing here because sharing is caring. Next term is filtration. Basically, the movement of water and solutes occur from an area of high hydrostatic pressure, key word here, to an area of low hydrostatic pressure. Now, the best example of this would be in the kidneys, basically the washer machines of the body that filter approximately 180 liters of plasma per day. Oh my gosh, that's like a ton of plasma. Oh my gosh, I know, right? Now, filtration is simply a passage of water and electrolytes through the arterial capillary bed in the interstitial fluid. It's all about fluid pressure, also called hydrostatic pressure, resulting from pumping action of the heart. All the way from the aorta down to the kidney washer machines directly. This pressure put on the kidneys helps the filtering process and helps the body wash out all the toxins and excess waste. But mainly they wash out HUC, hydrogen ions, which are acidic, urea, also called BUN, a byproduct of protein metabolism, as well as creatinine, a byproduct of normal muscle function. But we'll get to that later in our kidney videos. Our next term is osmolality, which refers to the number of osmotically active particles per kilogram of water. It's simply the concentration of the solution. Basically, how heavy and concentrated is it? Now, osmotic pressure is measured by millimoles, or MOSM. Now, the normal osmolality of blood plasma is about 270 to 300. Alright, so who cares about this and why is it hugely important? Well, when we're talking about isotonic, hypo, and hypertonic fluids, you know, the fluids that you're going to be tested on in your exam probably like next week, well, this becomes very, very important. Isotonic fluids have an osmolarity nearing 300, which is almost the exact same as human blood. It doesn't cause any fluid shifts outside the vascular spaces, so all that fluid stays inside the blood vessels. It's iso-perfect. There's enough pressure on each side of the membrane to really satisfy both parties. So iso-perfect. Next we have our hypertonic fluids. You guys remember those skinny cells? Skinny like a hyper person. So these are fluids with osmolarities that are greater than 300. Basically, they suck that fluid out of the cell, making it super skinny in hypertonic solutions. The solution in hypertonic fluids have an osmotic pressure that is greater than the body's. So the fluid from the body is being pulled out of the cell into the vascular blood vessel spaces. Now, this is done in order to dilute and equalize the osmotic pressure from this thick hypertonic fluid. Last but not least, we have my favorite, the hypotonic fluids. Basically big like hippos, so I call them hippotonic fluids. These have osmolarity of less than 300, basically less than the body's normal osmolarity. So the osmotic pressure is greater in the body. Therefore, when hypotonic solutions are infused to the vascular spaces, like in your blood vessels, then the fluids are pulled out from the blood and into the cell, making the cells big and fat and swollen like big hippos. Kind of like a magnet that draws fluid from the blood vessel space and into the cell. Now the cells become big hippopotamuses, so hypotonics are big hippos.
Now, switching gears to fluid volume overload, that overhydration. Clients have an overload of fluids. So just look at the O's here and think overhydration for overload. Now, the other names, this can also be called fluid volume excess, hypervolemia, and FVO, the short acronym for fluid volume overload. So clients puff up like a big old water balloon full of fluid. And naturally, this leads to big manifestations or signs and symptoms of edema, the swelling of soft tissues as a result of excess fluid accumulation. Now, although edema can affect any part of the body, it's more common and more noticeable in the lower extremities, like the legs and feet, especially toward the end of the day, because fluid pools while people maintain an upright position. So grading the pitting edema ranges from 0 to 4 plus, making the skin look like a memory foam mattress. So please be sure to write this down. 4 different textbooks say 5 different things, but these were the ones that were based on the NCLEX standards. So be sure to write these down. 0 plus is no pitting edema. 1 plus is 2 millimeters or less, basically mild pitting edema, and immediately rebounds for skin. Now 2 plus is 3 to 4 millimeters, which is considered moderate. We have a 15-second rebound of skin. And 3 plus is 5 to 6 millimeters. This is moderately severe. It takes about 30 seconds to rebound. And lastly, number 4 is the 4 plus, 8 millimeters or deeper. This is very severe. The skin stays indented for about 1 to 2 minutes, so it doesn't rebound until after around 2 minutes. Now, for the top 4 causes of edema, these are the 4 underlying pathophysiological processes responsible for the manifestations of edema. So number 1 is a huge test tip: increased hydrostatic pressure. So let the name help you here. Increased means high. Hydrostatic pressure is just fancy words for water pressure. Remember, hydro means fluid. So think high fluid pressure within the blood vessels, causing fluid to be pushed out of the vascular space, or the blood vessel, and into the interstitial space, resulting in edema. So we see increased fluid volume, and the manifestation here is high blood pressure and pitting edema, basically worsening edema here. So a great example of this is renal failure, where the kidney washer machines fail to filter the blood and let excess fluid out of the body and into the potty. Another good example is heart failure, where the heart fails to pump blood forward and now it backs up in the body and the lungs. So the memory trick here, just think HF for heart failure as HF, heavy fluid all over the body. Now the second main cause of edema is number 2, increased colloid osmotic pressure. As you know, where solutes go, well, fluids flow. Basic osmosis, right? Well, in the same way, decreased colloids within the blood, we have a decrease in fluid retention inside the blood vessels. You see, colloids serve to hold water within the vascular space, kind of like attracting it like a magnet. Normally created by plasma proteins, namely albumin, that do not diffuse readily across the capillary membrane. So be sure to write this down. Low albumin, we have low plasma proteins. So the memory trick, A for albumin, A for attracts fluid into the vascular spaces. So without enough albumin in the body or in the blood vessels, fluid leaks out into the third space, meaning fluid escapes the blood vessels and into the body cavity like the abdomen. So examples of this would be cirrhosis with liver disease clients. Since the liver makes albumin, liver disease results in decreased albumin, allowing fluid to leak out of those vessels and into the third spaces. Another cause for low albumin is starvation, since there's no building blocks of protein being consumed to produce albumin. Now, moving on to the third one here, increased capillary permeability. We have really leaky capillaries, those connections between the arteries and the veins, typically caused by severe inflammation or tissue destruction. And 2 great examples of this is bacteria causing infection and burns. So burns obviously damage the body, but specifically damage the capillaries, leading to edema from fluid leaking out of the vascular space. So let's play a little segment on pathophysiology of major burns. The pathophysiology for major burns. These can cause massive tissue damage and cellular destruction, resulting in widespread systemic inflammation that increases vascular permeability or capillary permeability. Just really fancy words for leaky blood vessels that fill up the body like a water balloon. So fluid, electrolytes, proteins, and other contents just spill over into the interstitial spaces, or the third spaces. Clients end up with severely low fluid volume intravascularly within the blood vessels, as fluid and electrolytes escape and now go into the tissues, eventually progressing into deadly hypovolemic shock, that severely low blood pressure that eventually causes death. This is why the #1 intervention for major burns in the first 24 hours, and big NCLEX tip, so write down these key terms: IV lactated ringers, or LR solution, and IV normal saline, that 0.9% sodium chloride. These two will help save lives. They are isotonic fluids, which we call isoperfect fluids, since they stay inside the veins longer than any other solution, as it closely resembles the chemical composition of human blood. Fancy words for it increases the fluid volume inside the blood vessels, increasing the blood pressure and saving your patient's life. So don't let the NCLEX trick you here. We're not administering 5% dextrose, that glucose in water, which is not an isotonic solution, and not 45% normal saline, or 0.45%. That's a hypotonic solution. Only isotonic solutions here. So write it down again: lactated ringers or normal saline. Biggest NCLEX tip. Now moving on to the last major cause of edema. #4, the obstruction of the lymphatic system. As you know, the lymphatic system is a network of tissues, vessels, and organs that work together to clean the blood. I call the lymphatic system the Lysol system, or even the drainage system, as it works to clean the blood and get rid of any waste that cells make. It does this with the help of white blood cells called lymphocytes, which fight infection, and works to clean about 20 liters of plasma blood flow every single day. Wowza! That's a lot of fluid. So obviously, if this system gets obstructed or blocked, then we have a major problem with a major backup of fluid. So the main causes include cancer, or a tumor blockage that blocks the lymphatic system, as well as infection, those big lymph nodes. Basically a traffic jam, as WBCs overload the system from fighting infection. Now moving on to the next topic here, fluid volume deficit, a common manifestation of dehydration. So clients have a deficit or a decrease in fluid. So just look at the D's here and think dry for dehydration and a deficit of fluid. Clients dry out like a raisin in the sun, appearing sunken in, shriveled up, and very weak, which we'll get into the specifics of manifestations and signs and symptoms in a moment. But first, why does this happen? So the top 4 causes: vomiting and diarrhea, like from food poisoning, infection, or just too much alcohol, like after last semester's final exams. You know what I'm talking about, right? Tequila is never the correct answer. It's actually the most correct answer. I'm just kidding. Okay, now hot body and sweating also releases fluid, including fever, heat stroke, and even thyroid crisis. And severe burns. This puts the patient most at risk for fluid volume deficit, since they lost a lot of fluid due to blister formation on the skin. As well as urination drains fluid from the body and into the potty. But really the big ones to write down here are the 3 Ds: DI, DKA, and diuretics. So the top reasons that clients lose fluid in the clinical setting here is DI, diabetes insipidus. So the memory trick for the 3 Ds, just think DI, think dry inside. Clients diurese fluid like up to 20 liters a day. We're talking lots and lots of urine here. Now the second reason here is DKA, diabetic ketoacidosis. So with DKA, think D for dry. Now we go into all the details in the full DKA video, but real quick, DKA we see an increased sugar concentration within the blood, that hyperglycemia, typically caused by infection, which also dries the body out, and a common manifestation is Kussmaul respirations, basically fast breathing, which leads to insensible fluid losses from all that fast breathing. Okay, the last D is for diuretics, like furosemide and hydrochlorothiazide. Now, these end in "ide," so think the body is dried. Now, as you will learn, diuretics drain fluid from the body and into the potty. So we also have a loss of electrolytes here too, mainly potassium, because as you know, where fluids flow, electrolytes go. Okay, now a quick side note before we go into manifestations. Compensation of fluid volume deficit and dehydration. Now the body tries to balance itself out by sending signals to increase that fluid intake. So we'll see increased thirst, the body's going to be holding on to urine, so we're going to have concentrated urine, as well as increased heart rate and vasoconstriction. Just think about it here. The body's trying to compensate, or basically make up, for the decreased fluid volume by pumping the little blood it has at a faster pace all around the body in order to perfuse or oxygenate the tissues here. So this is why we see increased heart rate and vasoconstriction.